I'm so excited. You guys, this is so impromptu, and I just had to do this. We are in our convention at Word of Faith International Christian Center with Bishop Keith A. Butler. That's just a church I go to. But I'm telling you, I am so fired up. So we have a special guest. One of our guests, and all the speakers have been just amazing. But one of our guests is Dr. Avery Jackson III, and he is a neuro scientist. He's a neurosurgeon, and OMG, his credentials are just from top to bottom. So, well, he's busy, and I love him, and I'm sure if I wanted to do a homemade video, he would do one for me. But I have a personal, my brother, my friend, my homie, Dr. John Adams here, and he actually is amazing in his own right. He is an anesthesiologist and actually a pediatric anesthesiologist. Now, he teaches it, he preaches it, and he is just full-blown love God and skilled in everything that he does. So Dr. Jackson, however, he talked about how he does a surgery, and I guess it happens often, but he was just giving an example, and I want to encourage everybody, go get those messages. I don't care what your religion is. I don't care what your denomination. I don't care if you love Jesus or you don't love it. It doesn't matter. I'm telling you, go to YouTube or Facebook, Word of Faith CC. You want to listen to the messages from all of our speakers for the conference. It will bless you. I don't care who you like and who you don't like. I'm trying to tell you, your life is going to change. But so Dr. Jackson talked about doing a surgery where he had to relieve the pressure off of the brain. And so he said he cut out part of the skull, and then, oh my goodness, and this is what flipped me out. He said, then we made an incision, we cut over the side, I believe, and he said that part of the skull that they took out, they embedded it in another part of the body, he said, for safekeeping. And so Dr. Adams here, I said, listen, you are my resident homie, hookup, medical professional. You are there in your own right. How in the world does that happen? And so I asked you to explain to me what, and you acted like it was just common. It's no big deal, and that's what you do. And you mentioned how the body, because it recognizes every part of the body. So listen. And he's a minister of the gospel. Did I tell you that he's a licensed ordained minister? I'm just saying. So when you put science and medicine all together and Jesus too, that's what I'm talking about. So I just wanted, that was so beyond fascinating to me. So tell me again, talk about how in the world that happens. You can do that and integrate it into the body, and it's just no issue.
Absolutely. Well, thank you for having me to present this with you. And I'll try to explain this way. The skull is a closed space, and anytime you have a hemorrhage, you have a tumor, you have edema, abscess, infections, or anything like that, it can put more pressure in the brain or pressure on the brain. We call that increased intracranial pressure.
Wow.
And when you have increased intracranial pressure, you have a hole at the bottom of the skull called the foramen magnum, and the contents will try to push down the brain in the brain stem through this tiny space, and it will cause this space to swell. Well, inside the brain stem, there's ventilatory centers which control ventilation. So if the pressure is not relieved, a person will become apneic where they don't breathe, and of course we know they'll die if they don't breathe. But also there's cardiac fibers and cardiac nerves or cardiac control cells there as well, which could cause bradycardia, which we know that's one of the manifestations of increased intracranial pressure. So what a surgeon, neurosurgeon, such as Dr. Jackson does, he make an incision into the skull. It's called a craniectomy. And so to relieve the pressure, after he cut through the skin, he used a drill, cut through the skull, and that would relieve the pressure. So the pressure would actually more come upward instead of be displaced downward.
Wow.
Now, sometimes to allow the swelling to subside and at a later date so that they can replace everything, they have to do something with the skull that they took off. And it's easy, it's really no problem for the body or for the surgeon to place that part of the skull into like the abdomen, because the body has antigens and it recognizes its own self. So it's not going to mount an immune response or it's not going to see that part of the skull as being foreign. So the skull could be there for an indefinite number of time. The only thing you have to be concerned about is probably scarring, but it's not going to amount an immune response where you would have an infection or you have white cells that cause an abscess or anything like that.
That is amazing.
And so at a later time, after the swelling goes down and it's safer, they can take that, go retrieve that skull, the piece of skull, replace it, plate it, close the skin back up, and the patient is back on their way.
That is amazing. That is just the most, I couldn't wrap my head around that. I said, oh my goodness. And so as an anesthesiologist, and I have a niece that's desiring to go to medical school, and she's like, listen, nothing happens without the anesthesiologist. You can be the best surgeon in the world. You can be, listen, without that anesthesiologist, nothing's going on. Because if you can't put them under, you can't pull them out. So have you been a part of any of that before in your career? Have you been a part of removing a piece from one part of the body and putting it somewhere else?
I have been practicing anesthesiology for over 20 years.
Wow.
And that's part of what we do is neuro anesthesiology, where we release pressure off the brain, resect, retrieve brain tumors, put bolts in, do VP shunts, all those kind of different procedures.
Wow.
So yes, I've been a part of that procedure numerous times.
Wow.
It's very common to do that. Also cardiac, plastics, ortho, we take care of all of that. And we see ourselves as part of the surgical team. And so, of course, if we put patients to sleep and don't have a surgeon, we're not achieving anything. Or if the surgeon cut and not have a patient anesthetized, then that's going to actually do more harm as well.
Absolutely.
So we're an intricate part of the team, the surgical team. And so I think it's a great profession. Our job is to make sure the patient maintain homeostasis during surgery. In other words, we want to make sure that the patient doesn't hurt. They don't feel anything. They're unconscious. They're not aware of what's going on.
Wow.
And then after the surgery is complete, they wake up and like nothing ever took place.
Wow.
So that's our job, to keep all the vital signs stable during the procedure. If the patient loses too much blood, we replace that. Make sure they get fluids, make sure they have the proper amount of pain medication. The surgical field is conducive so the operation can be performed. We do certain things to contribute to that as well.
Wow.
So,
that's amazing. So there you have it. So thank you so much. That was just so profound. And the way you do as well, because I know you personally, so we talk Jesus all the time. And but just to hear with Dr. Jackson and yourself as well, how the Word of God just is so intricately woven into the fabric of medicine and science. And so it was just beautiful. But when he said about taking the skull out and putting it in another part of the body, I said, okay, wait a minute. I have to ask my brother, break that down to me in layman's terms so I can grab it. So that's what I wanted to ask you. So thank you so much. Just a little informal. And you all know I love you all. And I know I wasn't the only person with that question. I know you all were blown away as well. So I just wanted to ask my friend. So again, Dr. John Adams, a wonderful man of God and also a medical professional. And so thank you so much. So just informal. I love you guys. And I hope you enjoyed this as much as I enjoyed talking about it. Thank you.